Well, our next witness is anonymous. And those of you who are here the first day we sat this week will know what that means, and will know that I'm about to read out an order which is made restricting the extent to which you can identify her after she has given evidence, or for that matter, during her giving evidence. And it reads like this. It is ordered that the name and address of witness W2315, that's Ms. S to you and me, and any other identifying information such as the witness's image or a description of their appearance cannot be disclosed or published in any form unless express permission is given by me or by the solicitor to the inquiry acting on my behalf. Witness W2315 must be referred to only as Ms. S. This order remains in force for the duration of the inquiry and at all times thereafter unless otherwise ordered, and I may vary or revoke the order by making a further order during the course of the inquiry. It goes without saying, of course, that you'll take care in taking photographs around the place so that you don't inadvertently capture her. Could we have Ms. S, please?
Thanks.
Ms. S, your full name is known to the inquiry. Could you please repeat after me? I do solemnly, sincerely,
I do solemnly, sincerely,
and truly declare and affirm that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Ms. S, you have von Willebrand's disease.
Yeah.
So did your mother, and so did other family members.
Yes.
You also worked as a technician in the Royal Edinburgh Infirmary Haematology Lab for a period of time.
Yes.
First of all, can you tell us what your experience is of the difference in terms of the type of bleeding between haemophilia and von Willebrand's disease?
Couple of things with haemophilia. It's my understanding from working there that in haemophilia, if somebody in the family has severe haemophilia, then any that inherit it will again have severe haemophilia. In von Willebrand's disease, one member can be more affected, they can have a more severe von Willebrand's, and another family member further down the chain, a child, might have it a bit milder. Also, in haemophilia, they have more joint bleeds, and in von Willebrand's, it's mucous membranes tend to bleed, so nosebleeds, gum bleeds, bruises, heavy periods, and in my case, in my mother's case, as we got into our 50s, gastrointestinal or GI bleeds.
We're going to start by discussing your mother. And over the course of her life, did she require much treatment for her von Willebrand's?
Not too much, given that her length of age, but she did go through a particular time in the early 80s, one where she'd fallen downstairs in her house and had hurt her ankle, and she had to cryoprecipitate for that. And then in 82, when she had banged her thigh, and that proved particularly troublesome, and she was in and out of hospital for quite a period of time and had a lot of cryoprecipitate, bed rest, would come out, have to go back in the hospital because it had reoccurred, and then in order to get her home in the February of, I think it was 82, she was 82 or 83, I can't.
83.
83. She was sent home with some factor VIII, so it would get her out of the hospital, needing to be just lying in a bed all day.
And you're clear that that was factor 8 rather than cryoprecipitate?
Yes, the reason it was factor 8 instead of cryoprecipitate is at that point I was still working in Edinburgh Royal Infirmary, and part of my job was to go and take bloods of people, get the results ready before they saw the doctor if they had leukemia, anemia, etc. And because I was used to taking blood, they said that if we couldn't take the cryoprecipitate home, but if they put my mum onto factor 8, could send her home, and I wasn't staying at home, but I could go have my tea at home and then give her the factor 8 that she needed on that day. This only happened 2 or 3 times from my memory because her veins had been used quite a lot, and I wasn't used now because I take prophylaxis myself, but I could take blood out, but to find her veins, it's difficult, so then she had to go back and get it done at the hospital as an outpatient.
And we can see in your mum's records that by the 21st of February 1983, it's recorded that she'd had multiple factor 8 infusions.
Yes.
When your mum was changing from cryoprecipitate to factor 8, are you aware of whether she was warned of any risks of doing so?
I'm not aware, and neither was I warned of any risks when I was asked, if we give you this product to take home, to give to your mum, are you willing to do that? It'll get her out of hospital. It'll be much easier for everybody, for my dad, everybody involved. And nothing was said to me about any risks. And I was the one infusing the product.
During that time frame, were you receiving any treatment?
No.
You and your mum attended a meeting at the Edinburgh Royal in about 1984.
Mm-hmm.
Can you tell us where that meeting was and what happened at it?
I don't remember too much detail about it. I do remember it being by that time I had left Edinburgh. I was working in Falkirk. I had come back for this meeting, and there was a big group of people from the bleeding community, as they'll call them, and it was in the ground floor of the old Royal Infirmary in a lecture theatre. And it was about some people might have been infected, but I don't have a huge recollection. But I do remember, I think my dad was there as well, and I do remember going away not being overtly worried about anything we'd been told. So I think if I was told anything too much in detail, I've been, and remember in those days there weren't computers, there wasn't, mobile phones and things, but I don't remember leaving that meeting thinking, oh, this will really be affecting my mum or me, so I don't have too much I do remember the meeting, but the detail of it.
And the infection that was being discussed was HTLV3?
Yes.
Shortly after that meeting, your mum was told she tested negative for HTLV3, and then Dr. Ludlam sent your mother's GP a letter. And if we can have 2315005, please, Paul. And if we look at the second paragraph, we can see reference there to a letter that had been sent about AIDS and haemophilia /VWD. And this morning we looked at a copy of what we think is the letter that's being referred to there, which was dealt with by the previous witness.
Yes.
And then it says, I really think the chances of her having received the virus are infinitesimally small, particularly as she's anti-HTLB, which is V3 negative. I therefore do not think it appropriate for her husband to wear a contraceptive sheath. We are much more concerned about the possibility of virus in sperm on a haemophiliac male being transmitted to his sexual partner. I've reassured Mrs. X on these accounts. Before you saw your mum's medical records, were you aware of any letter like this?
No.
In her records, your mum's liver function tests were abnormal over a number of years, and you've identified those records. You've also noted that from 1987, her blood requests had risk of infection on them. Mm-hmm. Do you think your mum was aware of that in 1987?
No. She wouldn't have seen when you go, you're just told your results. You don't get shown, here's your results.
Was she aware that her liver function tests were abnormal?
I
As far
don't-
as you're aware.
As far as I'm aware, no.
And is that the kind of thing your mum might have said to you if there was a concern?
I don't know, because, you know, there's that bit of protection and not saying, but she might have queried it knowing that I was a scientist and worked in the lab. She might have asked, what does this mean? And she never had that conversation with me.
In September 1992, your mum attended the hospital and said she was more tired than usual, but put that down to her age. Her bloods were taken, and if we can have 007, please, Paul. Date reported is the 1st of October 1992, and we can see that she tested positive for hepatitis C. And then if we can have document 2315012, this is a letter from August 1993 from a consultant physician to your mum's GP. They'd been treating her for resolving pneumonia, and if we look at the second paragraph there, it's noted that her gamma GT and ALT were both raised. I checked her liver function tests again today, but wonder if there's any record from the haematology department of abnormality in her liver function. At that stage in August 1993, was your mum aware that she was hepatitis C positive?
No, she wasn't told till the September.
And it seems from here that other treating physicians were also unaware in
Yes.
August 1993.
Yeah.
And then if we have 009, we have a letter dated September 1993 from a clinical assistant to Professor Ludlam to your mum's GP. And it says at the bottom, this patient, as with a number of others, has been found to be hepatitis C antibody positive, and this must relate to her having received blood products in the past when hepatitis C could not be identified. I've discussed this with your mum and said that we're currently running a joint clinic with one of the GI and liver consultants. As far as you're aware, the 15th of September, around about that time, was that the first time your mum was told about hepatitis C?
Yes, well, she's not told me, but since looking through her notes, and I've spent many an hour looking through all her notes a couple of times, and this is the first thing I could find about her. And could I just go back to her being tested and found hepatitis C positive in the September of 92?
Mm-hmm.
That the letter in September, she went and saw the doctor and said that she was feeling lethargic and unwell on the very day that the sample was sent for hepatitis C testing. And it was put down that her increasing lethargy, the letter from that doctor to her GP about increasing lethargy and tiredness, she put down to her old age. She was 65, the same age just about as I am. I take great offence to that, because on the same day as they've taken a sample or sent a sample to virology to be tested, and 2 days after this letter has gone to the GP to find she's positive, never mentioned to my mother or to the GP that in fact this lethargy and tiredness could be to do with having a hepatitis C affecting her liver, but let her think, and for a full year after, that it was her old age. Being that old age myself, I take great offence at that.
In your mum's records, and it seems to be connected to the September 1993 diagnosis, it's a little bit difficult to tell, but there's an information sheet enclosed. It's 2315014. And we can see at the top that it sets out that the sheet is to give you more information regarding the hepatitis C virus. Your blood tests show that you have the hepatitis C virus. This may cause inflammation of your liver, known as hepatitis. In some individuals, the inflammation in the liver may become chronic, giving rise to more long-term damage to the liver, which can in some cases be severe. There is then discussion of a possible treatment of interferon. And if we go to the next page, we can see the heading Sexual Transmission and Pregnancy. And the information sheet provides that studies have shown that there's a very low risk of sexual transmission of hepatitis C. This can be discussed with you at the clinic. We'll be offering testing to all sexual partners of patients who have hepatitis C infection. And if we go down to the section headed Alcohol, you'll know that alcohol can damage your liver, as you may have inflammation of your liver due to the hepatitis C virus. It may be prudent to limit your alcohol intake to a moderate level, and they recommend no more than 21 units of alcohol per week for a man, 14 units per week for a woman, and it says the lower your alcohol intake, the better. Are you aware of whether your mum received this information sheet?
Yes, that was the...
It was in the records,
Yes.
but at the time were you aware of her
No,
receiving
she
it?
wouldn't, again, share the...
But does this chime with the advice that you think your mum and your dad were given about the hepatitis C, of what was discussed at home?
Yes, because one thing I do remember, my mum was never a big drinker, but then, interestingly, at her older age, she went totally teetotal.
So this marries up with your experience of what your mum seemed to be doing in response to her diagnosis.
Yes.
Just before we leave this document, if we can look at the second page again, something we'll come back to. The second paragraph discussing the interferon treatment, it says in relation to side effects, at the beginning of a course of treatment, injections may be followed by a fever for a few hours. This is less troublesome if the injections are given in the evening along with 2 paracetamol tablets. With interferon, persistent side effects are uncommon. Occasionally, there may be tiredness, depression, and a fall in the blood count. These side effects are reversible if the dose of the drug is reduced. That's what was in the information sheet then. We'll come back to your mum's experience shortly.
Do we know who drafted the information sheet?
Unfortunately, it's not very clear where it's come from, but it appears to have been drafted within Edinburgh Royal because of the letters it's with, but I'm afraid that's somewhat inferential of who's drafted it.
Thank you.
After her diagnosis with hepatitis C, you and your mum had a conversation about having treatment in preparation for any procedures she was undergoing. Can you tell us about that?
Yes. My mum was always, the doctor's right. You do whatever the doctor tells you. He is God. Basically, whatever he tells you, we'd never question. And I remember her saying, oh, I'm going to the dentist, I'm going to the hospital, I need something to do my teeth scaled and polished, but I need to go and I need to get... She actually said to me, factor 8, before it, and I said, well, why, when you're just getting, scaled and polished? I go to the normal dentist, get scaled and polished, no problem. She said, because they told me I had to have it. And I said, no, it's your choice. You could have it on standby, and then if you bled, you can have it, but you don't have to have it before it if you don't want to. And she went, but they told me, and I went, it's your choice, it's your body, it's your... She went, can I? And I remember her phoning me after that going, I didn't take it, I didn't need it, I didn't, and being so excited that she had been the one to decide,
After your mum was diagnosed with hepatitis C, what was her health like?
Well, she was... my mum and dad had planned to travel quite a bit, to go on different holidays, to bowl, and she was just no energy, lethargic, and I'll be honest, my mum could be a bit nippy, and, my husband would pick up, your mum's not right. And I go, what? She said, because I can tell by her behaviour. And I was putting it down to normal behaviour. But now, you know, it was when, sorry, I preempted, but it's when she was having interfering treatment, she was just like, couldn't live with her. And I just put that down to normal. But my husband picked up when she was feeling either going through that treatment or feeling particularly bad, queasy. She couldn't eat a lot of things, eggs in particular. She just couldn't eat, no energy, just not feeling well.
You've said in your statement you thought that your mum was an old 65.
Yes. Well, I suppose given now people are, you know, 50's a new 40, whatever, but yes, she didn't have that. You know, you'd think that because she would retire at 60, and you think, well, the family have grown up, this is the time to go out and enjoy yourself and, you know, go and do different things, and they just, well, Dad and her just couldn't do anything. My dad will say there was one particular, went to Spain to enjoy a holiday, got one day out of it, and then could only go out for a meal at night, and it ruined, and he's saying never been on holiday again since, because what was the point? Just, you know, wanting the comforts of home, couldn't go anywhere.
You've said that your mum tried some interferon treatment. That was in about 1995. What happened with that?
Just felt absolutely awful, was fluey, shaking, shivery, just sick, just everything, to the point that she just said, I've tried it, and totally point blank refused from that point on to put herself through that.
Could we have document 2315013, please, Paul? It's a letter from August 1995, which notes that she'd had quite a bad reaction, particularly with headaches, to her recent trial of interferon therapy for HCV. I'd be quite keen for her to try the interferon therapy again, because she has type 3A, which is particularly responsive to interferon. She was, however, adamant today that she did not want it at present. And if we look at the last paragraph, she had been warned of the long-term risks of liver disease, particularly cirrhosis and hepatocellular carcinoma, but she wasn't prepared to try interferon again.
It shows how bad it was, that she'd rather go forward and maybe, and she did get cirrhosis, get carcinoma, than put herself through that treatment.
And ultimately your mum's liver did become cirrhotic, but she continued to decline any treatment.
Yeah.
Did your mum talk much about the hepatitis C?
No.
Why do you think that was? Why not?
A couple of things. One is she wanted to protect her family, but also my mum and dad are very private people, and they didn't want to, you know, people to know their business. And even though my mum's been dead for a number of years, she did get the skip-in payments, and just earlier this year, a relative said to my dad, you know, oh, I nearly said my mother's name there, that my mother, you know, oh, did they, you know, would have got some money, aren't you lucky getting some money? My dad was like, money's worth that. If you can do nothing with it, might as well be a piece of paper. And what are you talking about? I don't know what you're talking about. What infection? So even all this time later, and then went, there's the door, go through it. So you got that feeling that people weren't interested in her health and how it affected her, but weren't you lucky you got some money? So no, they would keep, they even didn't say, I didn't know until they got the stage 2 payment that they even got the first stage payment.
Your dad's reaction was a little bit different though, wasn't it? He was much angrier.
Oh yes.
Can you tell us about that?
Well, for him, you know, they've brought up a family, they've been together, this is, you know, we've got our plans, we can go holidays, we enjoy bowling, we like dancing. This is our time, and that time was taken away from them.
Since you've gone through your mother's records, you've discovered that in 1996 your mother wrote to the health minister at the time, Mr. Horan. Can we have 2315011, please? This is the reply she received on his behalf. It was written by who seemed to be one of his staff members. And it says this. In the second paragraph, as ministers have consistently stated, for example in the adjournment debates in the House of Commons in July and December 1995, the government has great sympathy with those patients who may have become infected with hepatitis C through blood transfusions or blood products. Factor VIII brought many advantages to people with haemophilia. It greatly increased life expectancy as well as improving the quality of life. If I can pause there, you were upset by that reference in the letter to haemophilia, weren't you?
Well, my mum's got von Willebrand's disease. This appears to me to be a mention haemophilia, never von Willebrand's. You know, my mum had von Willebrand's.
And your concern was that it's a generic letter that's gone out rather than anything responding to your mum?
Yeah, it was like somebody writes in, throw that one out at them.
It goes on, however, medical procedures rarely come without risk, and these are not always fully known or capable of being guarded against at the time. Most haemophilia patients were infected with hepatitis C before blood products were treated to destroy viruses. Those patients received the best treatment available in the light of medical knowledge at the time. It goes on to say that the government doesn't accept there's been negligence, and they have no plans at present to make payments to such patients. And if we go over the page, it explains why payments were being made to those with the HIV virus, and it says this: in the case of patients inadvertently infected with the HIV virus, the decision to make payments to those affected and to establish a hardship fund was taken in light of their very special circumstances. Those affected were all expected to die very quickly and were subject to significant social problems, particularly ostracism. Hepatitis C is different from HIV. Many people infected with hepatitis C may live for a long period without any symptoms occurring, and only a very small proportion are expected to die from the disease. It then indicates that the government is always ready to listen to further evidence. Were you aware of what your mum thought of this letter? Was anything around the government's position discussed at home?
No.
You've just found this in her records?
Yes.
In about 2002, you think your mum applied for money from the Skipton Fund. And again, in her records, there's a letter from Professor Ludlam to her GP saying your mum had been to see him, and she'd been told by the Scottish office that compensation would only be given if infection occurred after March 1988. Were you aware of that at the time?
No.
She did ultimately receive Skipton payments, as you've said. When your mum had to go into a care home, what difficulties did those payments cause you?
Quite a bit, because my mum and dad, they've shared everything, so they've got joint bank accounts, so the money all went into their joint bank account. And because at that point I had got power of attorney for my father for his financial affairs, it was actually too late. I would just had to have gone to guardianship for my mother, because that time she was deemed to have dementia. So I was filling in the forms that Edinburgh Council needed on my mother's behalf, but really for my father. So it was about all the income you got, your pensions, and also, and I was aware, and you had to give 6 months bank statements to the council, but I was aware a big amount of, they only had pension, small pension, so I was aware a big amount of the money that they had was Skipton money. It wasn't anything that they got from anywhere else. So I was saying to them, well, Mum's got this money, and I also had someone that knew somebody that worked at the care inspectorate, And they had spoken to a lawyer, and they said, and I said, so it's not to be counted. And he said, oh, I've spoken to the lawyer, and what I was being told by the council is, you've got this extra money, you can voluntarily give extra to pay for your mum's care. And I said, no, but that was because my mum had hepatitis C, so I was being told it had to be counted in. And somebody from the care inspector had spoken to the care inspectorate lawyer who'd said, no, this money does have to get counted in. It's like disability living allowance. It's meant to improve your mum's care. And if that money can be used to get you, used towards her care in the care home, then it should be counted. And I said, I looked her in the eye and I went, you're wrong. And then I had to get in touch with Skipton, who got a letter from the Caxton Fund saying it was to be discounted. But I had to go through all the hoops at a very difficult and emotional time to prove to them they didn't know that this was true. I had to get the evidence to prove, no, you cannot use it when trying to, because they've got to work out how much. Because, for example, my parents' married couples pension had to be separated into single people's pension and my mum's attendance allowance, etc. But then I had to go through that loop to say, you cannot take this amount into account because it's to be discounted. But I was the one that had to prove it. They didn't. They were telling me the contrary.
And for you, that was an added stress when your mum was really very unwell.
Yeah.
And she died.
And it was more even my, not even so much for my mum. She had dementia. I didn't know so much, but can you imagine the loss for my dad of over 60 years together, of having to give up that care of somebody he loved to strangers? No, it was a horrible trying to deal with it and deal with our emotions, his emotions, and all the loss then.
And your mum died about 3 months later, in 2012, when she was 85.
She would have been 85 quite soon after. Yeah.
On her death certificate, it records that she died of pneumonia as the main cause, and it lists cerebrovascular accident, dementia, and von Willebrand's disease. Mm-hmm. You're unhappy about that. Why is that?
Well, there's no mention at all of hepatitis C, and I can only surmise. But one of the things I think why that happened is when my mother was moved to the care home. It was in a different part of Edinburgh, and so the GP that comes to the care home is the GP that my mother had. So that GP only knew my mother for 3 months before her death, maybe saw her, 2, 3, 4 times, whereas the GP that we'd had since 1954, and who knew the family history, who knew her much better, and I think would have attributed hepatitis C. I think it was just put down, well, the first 2 are pneumonia and CVA, so it was just put down to, she's got to 84, old age.
And you feel quite strongly that the hepatitis C and the cirrhosis should have been recognised on her death certificate.
Yes.
It also, that in itself caused problems for your dad in terms of financial assistance.
Yes.
What happened?
Well, in Scotland my mum was getting money that stopped, but then there's a Scottish system where a widower can get 75% of the money. And I asked a couple of people and they said, oh, well, if hepatitis C is not on the death certificate. And I suppose in people's defence, I could have looked it up. But also in their defence, how many people have actually reached into their 80s? But I was told if hepatitis C isn't on the death certificate, then the chance of your dad continuing to get any money is nil. And so when money became available, and it wasn't until I was up one morning quite early, leafing through my iPad as I do, I thought, oh, well, it was a bit ambiguous as well, because it said, if it's a widower still staying with the person, I thought, my mum's in a care home, so they're not actually staying. But I thought I might as well find out, because my dad did used to go and visit every day, and he has been awarded that money. And on a personal note, gets an amount every month, and on the 15th of the month, although he's doesn't walk very well, I'm going to get upset now. We'll go to Tesco's with his Cashline card on the 15th of the month, put it into the machine so that he can see he's got Mammy's money, that he can do diddly squat with, but it's Mammy's money, and it's still a connection to her.
But he worries every month whether the money will be there.
What if it's stopped? What if they don't give me it? You know, and it's like, but you know, you don't need it, but it's Mammy's money. It's Mammy's money.
And he's worried that one day it will be taken from him.
Yeah. Yeah.
I want to move on to talk about your own situation. First of all, your work in the haematology lab at the infirmary until 1983. Professor Ludlam was your boss.
Yeah.
Can you tell us about your experience of testing blood, and in particular the handling and labelling of high-risk blood?
Mm-hmm. Well, when a blood came in, you'd get a whole load of bloods together, and you would put a sticker on the form that would ultimately go back to the patient's notes, and a sticker, it's good that I've got this with me, sticker on the sample that would then go through machines. And these samples would come in, you'd have the form, it still happens today, form and the sample of blood, and it would be in a plastic bag. But those that were labelled as high risk would be kept to the end. So there'd be a sticker on it saying risk of infection. You would keep them to the end. You would put all the other samples through the machines, and then at the end, the ones that were high risk would be labelled. And some tests would be done in a fume cabinet, but other ones would be put through the machine. At the end of the day, you had to get dressed up in a neck-to-floor apron, gloves on, a visor over your face, and once the samples were put through, results out, the machine would be cleaned at the end of it. So,
what did you understand the risk to be at that stage, before 1983?
Well, before I suppose 1983 it would have been query HIV, or even hepatitis B was a big problem in the labs at the...
At the very least, you were conscious that it was
something.
High-risk blood, and there was something that you had to be careful of.
Yes.
In the lab, were you aware of blood samples being taken and stored?
Yes, because some had serum for storage, you know, maybe put on the side. So you would test the blood and then keep a little sample, and these could be frozen or put elsewhere. Some to be tested maybe straight away, and others don't know when they're tested, but maybe stored for a later date.
And were you aware of people in the lab undertaking research?
Yes, I wasn't involved in it, but there were a group, maybe 4 people that were for research, because that was a new thing. You didn't have people doing research, and then there was, you know, a few people taken away to do research.
But you're not sure what that research was?
No.
Because you weren't involved?
No, I wasn't involved.
What's your understanding of the high-risk blood meant for you when you've needed to receive blood products?
Well, high risk is, well, I can only give my example of when I was pregnant in 1990 and then had an emergency caesarean in 91. Dr. Ludlam wasn't only my boss, he was my doctor. And when I was having the amniocentesis, it said, oh, I want you to have factor 8 before you have amniocentesis. And I went, no. I remember because I remember at one point I said, oh, we had this argument about it, and he said, no, we had a discussion.
Can we stop the live stream, please?
Oh.
You've just said your own name.
Oh. Okay.
So easily
Miss
done,
S
don't
said.
Stop the stream.
Right. Miss S said.
We'll just wait for the technicians
Right, no
to
problem.
tell us that we can start again.
Okay.
You were just saying that Dr. Ludlam wasn't only your boss, he was your doctor, and you needed to have the amniocentesis, and you had an argument about whether you should have factor 8.
Yes.
And what did he say to you about it?
And he told me, and I said, no, I'll have it on standby, but I don't want it. And he said, it's safe, you can have it now. But I said, no, I don't want it. And then the same, when I needed the emergency caesarean, had wanted me to have factor 8 before the caesarean, and I said, no, I'll have it on standby. If I need it, I don't want to put myself at any risk, unnecessary risk.
You've not been infected with HIV or hepatitis C, but what are your feelings about that now?
My feelings are that I've kind of dodged a bullet because can I speak a bit about when I was at the Penrose?
Absolutely, I was
Right.
going to ask you that next. So go
Okay. I went to the Penrose inquiry final report, and as I said, in October 90 and March 91, factor 8 was, and then what I heard was, blood until 1991 wasn't tested for hepatitis C. And I think at that point I went into shock because I thought, October 90, March 1991, my mum's got hepatitis C because the Penrose was in 2015. I could have had hepatitis C. And then it wasn't actually until I spoke to Jamie, from Thomson's, thank you, Jamie, that he assured me that it was the factor 8 was tested for hepatitis C. Before that, it was the blood that wasn't, like red cell concentrate, wasn't tested till 91. But then I thought later, but if after the amniocentesis, or I had the caesarean, if I'd bled, I would have just been given a blood transfusion, no questions asked. It would have been, you need this. And so I could have got the hepatitis C. So yeah, I think I was just in a bit, you've told me it was safe, and it wasn't.
That had quite a significant impact on your mental health, and you've had some psychological support and counselling, but only very recently.
Yes. I mean, I'm actually known as the eternal optimist, so the fact that I went into shock and that after, I don't think ever in my life I felt so bad as after that Penrose report. There was a church round the corner from the museum where the final report was read out, and there was people from Haemophilia Scotland. It was great, but I spoke to a couple of people, then I thought I need to get away. And I remember going down to Princes Street, and there was a really lively band, and normally I'd be dancing along the street, and I felt so low, so sick to my stomach. And I kind of laugh about it now, but as I was waiting for the bus, there was this man, he looked a bit dishevelled and down and out, and I went up and I said to him, excuse me, I've had such a horrible day, I want it to end in a better note. I thought he was homeless, would you take £10 off me just to make my day a bit better? And he went, okay, thanks. Thinking he's homeless, he might have been a guy just going home for his work. I was like, but it was what I did to make myself feel better. And then I can't prove it, but interestingly, although I'd been quite steady, chronic and acute blood-wise in my gut, 2 weeks later I had an acute GI bleed, and it went through a horrendous time and had to have, from then started to need prophylaxis for my GI bleeds. And going back to something you've shown before, where it's the letter from the government, I remember reading that and being so incensed, and family member was in and knowing about that I'd had the bleed 2 weeks after the Penrose report, not being able to link it 100%. But when I was actually spitting blood, the wording on that letter said, Mum, please take care of yourself. You know what happened to the Penrose. Please, please, calm down, think of yourself, stop. It's difficult, but...
You've also said in your witness statement that people have said to you that that's all in the past now and move on, and you've said, I remember inside thinking for you maybe, but not for me. I think that's what happens a lot with hepatitis C. There's some money, let's move on, but it doesn't go away. I injected my mum a couple of times, and it could have been me that gave her the infected products too. Can you imagine doing that to your child? And that's something else that you've struggled with.
Yeah, and I can't tell my dad.
Your dad's too frail to cope with.
He's not frail at all, he's
Not too
he's really
too elderly to manage it.
I just don't want to be the one to tell him, Dad, possibly I could have injected Mum. How can I say that to my dad? He loved her to bits. How could I say it? I didn't even realise myself till I actually read the notes. And I swore. Meant that could have been me that gave that, because I took it home only maybe 2-3 times, but it still could have been me, and then have that huge empathy for people, given what they thought was the best thing for their child, choose, you know. So, and I've done it to my mum. My dad still misses my mum all these years later. By the way, Dad, could have been me injected it. Nah. That's why I can't tell him. If he asks me, I'll say it's to give you and Mum a voice, but if he was sitting there now, I couldn't speak. I couldn't tell any of this because I couldn't say that to him.
Those are the questions I have for you. Is there anything else you would like to say?
Yes, and a couple of things. In going into, I know maybe you don't want to dwell on the Penrose, but there was one thing I remember also from being in shock of I could have been infected. And I remember what I was left with was from the Penrose final report. I have to think of the doctors, they were affected too. And I was like, and I've held that for these years, and I've thought, so when I had this and I knew I'd sworn an oath, and I thought, did I really hear that? So I actually went online and I looked at the Penrose Inquiry final report. And I've got it word for word. The executive summary, and it was March 2015, and it's under communication of results, the last paragraph. Is it okay if I read out where I've taken that from? Were a new disease like AIDS to emerge today, the patients would probably be made aware of the medical profession's ignorance of it. And this is the sentence, and share all the uncertainties and anxieties consequent on that. So the doctors are holding the uncertainties and anxieties. There would still be suffering and probably anger against the disease, but the sense of betrayal would be absent. Sorry, but I still say it's crass in the extreme. So that, you know, the medical so I read the doctors shared, they were the ones with all the uncertainties and the anxieties. And if they'd shared, we could have shared that too. What about all the uncertainties and anxieties and ill health that you're putting down to your old age? No, it just infuriates me, sorry.
I'm just going to turn and ask Mr. O'Neill, Mr. Dawson, if there's anything they would like me to raise. Mr. Dawson has said that he thought you had something else you'd wanted to read out, not just the point about Penrose.
No, I've got a final thing I'd want.
Yeah,
Is that okay?
that's now's a good time if you want to say something else before I ask you,
Yeah.
Mr. Dawson.
I've written it down because I'll probably get upset again. I wanted to take this opportunity to tell my parents' story, to give them a voice. The inquiry's heard what happened to my mum, and I'd like to conclude by using my dad's words. Something he says on a regular basis, but I also feel has further meaning. Firstly, my dad says this as he fondly reminisces about the 60-plus years he spent with my mum. That saying is, they days, they'll no come back. Secondly, in recognition of both the quality and quantity of time those infected and affected have been denied, they days, they'll no come back. And finally, to Sir Brian and his team regarding the responsibility and, dare I say, hopes resting on their shoulders to get answers, to sort out inequalities in the financial and psychological support people are afforded, and to hold those responsible for this disaster to account, thereby ensuring their days, they'll no come back. Thank you.
Mr O'Neill and Mr Dawson had 2 points they wanted me to raise in addition. Firstly, you spoke earlier about Dr Ludlam telling you that the product was safe in 1990-1991 when you needed it, when he told you needed it for the amniocentesis in the emergency section. Did he explain to you what he meant when he said they were safe?
No.
How do you feel about that?
Incredulous. I worked in labs, I've got a scientific background, but that's how it was. It was like, you take my word, I tell you something, you believe it, you do it, full stop. Even the fact we had the argument, which was then called a discussion about, no, I'll have it on standby, that didn't please him. But I was adamant, no, I will have it on standby.
And secondly, we mentioned that you had some counselling, and that was actually bespoke counselling for people with a bleeding disorder.
Yes.
What's your experience of that been?
Oh, invaluable, because I think it's very important, because things that you think you've dealt with are over or whatever, they don't. And actually today, thankfully, I've had the Red Cross to speak to as well, because it's not just going in this process, it's not just going through the notes that are pertinent to this inquiry, but it's finding out other stuff in the notes nearer my mum's death that I wish I hadn't read, but that I have. And I'd like to say actually one more thing for those infected and affected who feel they can't give a statement or can't come here and give evidence. I salute you. Take care of yourself, because for you that's the right thing, because this isn't easy.
And part of why you found that counselling so positive is because it is specialist to people with bleeding disorders.
Yes.
And there's a real understanding, you've said, of that situation.
Yes, because it's because it's so specific. I can have counselling. I actually have a counselling advanced diploma, so in part of it I had to have counselling about this, that and the next thing, but to actually have focused counselling about what it's like being in hospital, going on hospital, everything involved in it, and fears around that is invaluable and should be expanded.
Can I make one comment? In my view, you are no more guilty of infecting your mother than was the syringe. It needs to be said publicly. But I do appreciate and thank you for your courage, despite your feeling that you were guilty, in coming to tell us about your mother. It takes, as you said, it's not easy. You've done it. Thank you very much.
Thank you.
Well, that is the end of the evidence for today. Now, tomorrow we start at 10, and who are we hearing from tomorrow?
We'll be hearing from Bill Wright, Rosemary Wright and Richard Titheridge.
Tomorrow, 10 o'clock.